Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today we're doing a Brotox treatment. So this is Botox for men. And yes, men get Botox too because they also care about wrinkles and lines and correct?
Correct.
Absolutely, right?
Yep.
So, and you've had the Botox previously
Yes.
and you just like how it makes you
Yeah,
feel?
it just rejuvenates my face, and I feel younger anyhow. Makes me
Absolutely.
look younger.
Yeah. And so for those of you, most of you are pretty familiar with what Botox does, but I think there's still confusion with some people as to what exactly it is. And so Botox is a muscle relaxant essentially. And so it gets placed into specific muscle groups and it allows those muscles just to be relaxed and not contract. And then in turn, that helps the muscles to not make those wrinkles. And so the wrinkles start going away and you lose, specifically we like to treat what we call the 11 lines here. This is called the glabellar area. And can you squeeze your brows together for me? So this is the action that happens without Botox. And then once we place the Botox, if I had asked him to squeeze, he won't be able to make that expression any longer. And then in turn, these lines that have started to etch into the skin will start going away. And it also trains you not to make that expression as much over time. So I feel like patients need less and less Botox with time as the muscle atrophies, and it also retrains you not to make that expression. Now, we had done a little Botox like touch up previously, and it's still holding pretty good, but we're going to go ahead and redo it now. I think it's been like about 4 or 5 months,
Yeah,
right,
about five
since
months. Yes.
since your last treatment. So that's pretty good.
Right.
And then we're going to treat around the crow's feet, and then I'm also going to get his bunny lines. Can you squeeze your nose for me? See those bunny lines that form right here? We're going to soften that up because if we just treat this and then you still have bunny lines, it can look a little funny sometimes.
Right.
So
Don't want that.
we don't want that. And then actually later, a little bit later when he has some time for recovery, we are going to do an Accutite procedure and get rid of these bags under his eyes and make the under eye area look smooth and firm as well. So, but let's go ahead and start with the injections here. You ready?
Yep.
Okay. So. All right, so let's go ahead and can you squeeze your brows for me again and see where those muscle groups are and relax? You doing okay there?
Yeah.
Little ouchie.
Really can't even feel it.
Oh, that's awesome. Squeeze again. Okay. That's pretty good there. And then we'll go across the nose here. And can you squeeze your nose again for me? Okay, relax. And we'll get some of these sides here. Botox takes about 2 to 14 days to fully set in. So this is not a procedure where we're going to see an immediate improvement like a filler, which is often confused with a Botox because they're both injectables, but fillers actually add volume. So we inject those under the skin. And for example, if we were to inject under this line, it would make that line go away immediately because it would plump it out and fill it. With the Botox, it's just going to relax the muscle. Within a few days, you won't be able to make that expression as much. And then over time, the wrinkle is just going to go away. Okay. And then lift up your brows for me. So this is where we really need to make sure. We also don't want to feminize the brows in a man, because with men we don't want a high arch or for the brows to go up, right? I mean, some men do actually like a more feminized look,
No.
believe it or not, but in general, we want to keep that more flat and horizontal, and the brows in a more horizontal position rather than an arched position. In some patients, if we ask them to lift their brows, you can almost see that the brow is not lifting just from the frontalis muscle, but they're also recruiting their scalp muscle, to kind of lift their brows. And in that case, I will sometimes inject further back into the hairline even. We're going to go straight across here. This is a little different method than we would use in a female brow. And lift up your brows again. Lift up your brows again. Let me just see. And one more lift if you don't mind. Just want to make sure I'm high enough. Okay. Okay, and then smile. Relax. Okay, we're done.
Okay, that was easy.
That was easy,
Yep,
right?
yep.
Yeah. And then within a few days, you will look rejuvenated, refreshed, and onwards, right?
Right.
Okay.
Great job.
All right.
Always.
Yeah, thank you so much.